The fetal skull is the bony structure that encases and protects the developing fetal brain. It is not a single solid bone, but a collection of several flat bones joined by fibrous joints, which make it flexible for brain growth and passage through the birth canal during labor. Main part of the fetal skull. These are bones of the fetal skull. 2. Sutures. These are the fibrous joints between bones. And then 3. Fontanelles. These are the membranous soft spots where sutures meet. Bones of the fetal skull. These are the frontal bones. Consist of 2 bones which form the forehead. 2. Parietal bones. Consist of 2 bones which form the sides and the roof of the cranium. 3. Occipital bone. Consist of 1 bone which forms the back of the head. 4. Temporal bones. Consist of 2 bones which form part of the sides and the base. Take note, the sphenoid and the ethmoid bones are present but not obstetrically important. Sutures of the fetal skull. Sutures simply refers to the fibrous joints between bones. And these are 1. The sagittal suture. This is found between the 2 parietal bones. 2. The coronal suture. This is a suture that is found between the frontal and the parietal bones. 3. The lambdoid suture. This is found between the parietal and the occipital bones. And lastly, the metopic suture or the frontal suture. This is found between the 2 frontal bones. Fontanelles of the fetal skull. Fontanelles are simply the membranous soft spots where sutures meet. There are 2 main fontanelles, and these are 1. The anterior fontanelle, also known as the bregma. This is a diamond-shaped fontanelle which closes at approximately 18 months. It is located at the junction of the sagittal, coronal, and frontal sutures. 2. The posterior fontanelle, also known as lambda. This is a triangular fontanelle which closes by 6 to 8 weeks. It is located at the junction of the sagittal and lambdoid sutures. Other fontanelles are the sphenoid fontanelle, which is irregular in shape and closes by 6 months. It is located at the junction of the frontal, parietal, and temporal bones. The mastoid fontanelle, also irregular in shape and closes by 6 to 18 months. It is located at the junction of the parietal, occipital, and temporal bones. Regions of obstetric importance. 1. The vault. This refers to the upper curved part, which consists of the bones, the sutures, and the fontanelles. It is important in molding during labor. 2. The base. This refers to the thick, ossified, and not easily compressible part of the fetal skull. It protects vital structures like the cranial nerves and vessels. 3. The face. This refers to the bones of the face like the maxilla, the mandible, among many others, but these are less important obstetrically. A quick recap of the obstetric importance. 1. Fontanelles facilitate molding of the skull during birth. 2. Fontanelles allow for rapid postnatal brain growth. 3. Fontanelles serve as clinical landmarks. For instance, in dehydration, there will be sunken fontanelle. In raised intracranial pressure, there will be a bulging fontanelle. And again, fontanelles and sutures help midwife and doctors determine the fetal position and presentation during labor by vaginal examination. Thank you for watching. There will be a set of questions on this particular topic on our website at medentweb.com. If you've not followed us yet on YouTube, do well to subscribe at Medent Tutorials. If you're on Instagram, follow us at medent_edu, and on Facebook at Medent, and of course on TikTok at medent.tutorials. Once again, thank you and see you in my next video.